At Midtown Dentistry, we use the Cadillac Neutron sonic scalers. We would like to talk about them as different to the Profi jets of old, the old ultrasonics that we used. These tools are attached to every one of our units and is used for prophylaxis and perio treatment, as well as removal of cement and even refinement of crown preparations on teeth. The Neutron is different than other systems because it has what they call a cruise control system, which means that it auto-tunes and adjusts the speed of the tip depending on how worn the tip has become. The unit will recognize the weight and dimensional changes on the tip and increase the power to it to make it efficient for you to use the tip at all times. It also allows you to use these tips with a push and pull, which means you can both push the tip and pull it on the tooth with getting the same amount of power. And of course, feedback is real time, which means if you hit very strong calculus or cement, the device will know to up the power until you can cut through that calculus. It means that the vibration is more comfortable for your patients, and the handpiece has less vibration and heat to bother both the patient and the operator. It's very important to remember that there is a color coding system for the tips, and each tip needs to be used at the correct speed or strength for it. There is a low power, which is called green, a medium power called yellow, a high power called blue, which is for sustained effort in scaling, and of course the orange, which is very high power, and we use that to loosen crowns and posts. The tips for our piezo scalers come in different sizes and shapes, and they can all be found in our kits. Our kits come in two different variations. One is the original Cadillac kit, which has plastic sheaths color-coded to protect the tips. The other one is our own proprietary kit, which is a silver kit with a white handle. These are the handles to take the tips right off of the handpiece. As you can see in this video, you will put the white handle on top of the tip, engage the tip, turn it around, and spin it until it comes out. The same for installing a new tip on the handpiece. You will pick it up, spin it onto the tip, and you can do that with manual or finger pressure, and then place the handle on top and tighten it. Remember that if the tip is not tightly on the handle, it will come apart in the patient's mouth or malfunction and stop working.